Hello, on this video you will learn how to deal with someone who is choking. A choking situation is very distressing, A, for the person who is choking and also for the people in the close vicinity. So as always, what we need to do is remain calm, and we need to look at the situation and decide what we do. Well, the first thing to do if you suspect someone is choking is to encourage them to cough, because if the person can maintain coughing, then there is an element of air actually getting into the body, so there's a possibility they may expel the object themselves. If the coughing's not working or they go silent, then we need to physically step in and offer some treatment. So the first thing we do, we consider the use of what we call back blows. So what you do is you stand to the side and slightly behind the casualty, support them across the middle and push them forward. And with the heel of your hand on the spine between the shoulder blades, you deliver a maximum of 5 sharp blows. So we hit once and then see if it's come out. We hit again and then see if it's come out. Obviously, if we do expel the object at that point, end of story, job's done, let them get the breath back, sip of water, carry on with what they're doing. If not, we continue for up to 5 blows. If after the 5 blows the person is still choking, we then perform what is known as abdominal thrusts. And abdominal thrusts means that you come around the back of the casualty, you slide your arms through and make a fist. You turn the fist inwards and place it just above the casualty's navel but below the rib cage. You grasp the fist with your other hand and you push, or pull I should say, in sharply inwards and upwards. So it's a sharp inward pull just under the rib cage. And what this actually does, it simulates the effect of coughing, and it forces the diaphragm against the lungs, which forces air out of the windpipe, and it's a very effective treatment. Again, we would deliver a maximum of 5 of those. If you do have to perform abdominal thrusts and it was successful and the patient's airway is now clear, it is still really strongly advised that the person is seen by a doctor afterwards because of the potential for internal injury from the abdominal thrust. But the main thing is that the airway is clear. If the abdominal thrusts don't work after 5, we revert back to the back blows. And so at this point we're now looking to repeat the sequence of 5 blows, 5 abdominal thrusts until the object is expelled. Or, of course, if we're not successful in expelling the object, the patient will now start to lose consciousness. And at that point, if we haven't already done so, we certainly need to get someone to call an ambulance. If the person does lose consciousness and they're now flat on the floor, we treat the person as a non-breathing casualty, and as with all non-breathing casualties, we make sure the ambulance is on the way and we commence CPR. Okay, I hope you found that useful, and as always, I'll see you again soon. Thank you.